Good morning. I am not in my office or at home, so I'm just struggling with my with the layout of the monitor. So I hope you can see what's going on here. Thank you very much for the opportunity to present. It's rather a long title and rather specific, but I hope that those of you who teach in other areas can find something of interest in what I developed. So my plan for the next 10 minutes is to give you a little bit about the context of the program and the course in which I embedded this, and then describe the fundamental idea, a little bit about how it worked, and a little bit about feedback. So the context is a professional practice course in the physical therapy program that I have either taught or co-taught for a number of years. It has a number of elements of content in it, but the relevant ones for the innovation, the knowledge learned by students is around legal statutes governing practice, professional standards, and professionalism generally. And in the fall term 2020, which is what I'm going to be describing, it was entirely remote teaching, about 50% synchronous sessions and 50% self-paced learning. And so we were kind of scrambling to figure out some of the ways that we could adapt some of our assessments. And I've been thinking for years about how to figure out a really good way of assessing professional communication as a clinical skill. We often think of clinical skills as being the ones that we use, that we do with our hands, that we do in physical contact with patients, but in fact, communication is a highly relevant clinical skill. And so the pieces I show on the left bullets are around the elements of professional communication that I was trying to figure out over the years how to do better. And so those of you who know Miller's pyramid, Miller was writing about medical education over 30 years ago. The concept that students know the relevant laws could be tested with multiple choice. Knows how would be to describe how they'd respond to a scenario. And I wanted shows how, which is show me how you would actually do that. So one of the scenarios that I used, I developed 3 scenarios, 4 if you count the practice one. And I'm just going to describe one in a little bit of detail. So what was stated in the vignette or the scenario that was presented in the test to the students was that they could imagine themselves on a clinical placement at private practice. And they have an encounter, which is a normal patient treatment, with a patient who describes a previous experience. And the student is asked to imagine they later realize that patient's description is of an unqualified practitioner, so-called holding out. And the insight the student needed, so that what they had the knowledge was this professional standard around what their supervisor was responsible for, and the concept under law in Ontario of a mandatory report for if there's reasonable evidence to suggest that someone is holding themselves out as a physiotherapist when they're not. So the task for the student was imagine yourself phoning the patient, leaving a voicemail, explaining the knowledge, the new knowledge, the report to be made, and the assurance of patient confidentiality. So the basic idea was record a video voicemail. And you might ask, why voicemail? Is it authentic? Voicemail isn't entirely authentic, but phoning people to have communication is very authentic. The only piece we had to sort of ask students to suspend disbelief is that they would leave that much information in a voicemail rather than saying, here's who I am and can you call me back? The reason why we had to do voicemail is we were scrambling. This was the fall of 2020 and we hadn't planned for synchronous actors. So we needed a plan for asynchronous grading. And the only reason why video is to verify the identity of the student. I had a photo roster of the class, and also I could have checked if I couldn't hear them properly for audio quality. I could try to look at their face to see what they were saying. So how it worked. So the flowchart I'm going to show is some elements of preparation, test day, and grading. So in preparation, I set out detailed instructions and an FAQ document weeks ahead of the test. I provided a sample scenario, and I recorded a response that they could listen to that showed them the kind of thing I was going to be looking for in marking. And the quiz interface in OnCue is simply a one question, like an open-ended answer where submit a video. And then they could practice with that to just understand the interface. So if you go along to the middle here at the bottom, time 0 on test day, scenario 1 was revealed as a PDF document in OnCue, and above that, quiz one interface opened. And they had 20 minutes before the next one was going to be revealed. So it was probably about 5 minutes to read, 5 minutes to think about it. Took less than 5 minutes to record because most of these were 1.5 to 2.5 minutes long. And then a 5-minute stretch break before the next one. And we repeated the process through 3 scenarios. So the whole process took an hour. I had pre-developed some rubrics that were applied during grading, and then subsequently after the grading, the students were provided with feedback and their grades based on the rubric. So just to show what one of the rubric for that one looked like, if I draw your attention across the top, it was a 0 to 2 system for everything that was in the rubric, from 0 for the element was missing and 2 for it was excellent. And if you scroll down the items on the left, I'll draw your attention to my color coding. The blue represents things that are real content, knowledge content that they had to know and demonstrate that they knew in order to do well. The elements that are red are sort of extending from the knowledge into the professionalism component of how to do it, like clearly identifying yourself and the reason for the call. And then the black elements were in every rubric of all 3 of them, which is just basic good professional communication. So the other scenarios, I said I used 3. One of the other scenarios was for the student to imagine they were on a placement in a long-term care facility with a patient who had partial capacity for his own decisions, so some degree of cognitive impairment, and had a power of attorney who was his daughter. And the student's task was to imagine that there was a new need to change the plan of care, and they had to phone the patient's daughter, leave voicemail explaining why a meeting was needed. And the final scenario was for the student to imagine being on a placement in a home care context, in a situation where a PT assistant would be carrying out some of the plan of care and a patient who had supplemental oxygen as part of the plan of care. And the task was to imagine that the PTA had left them a message with a question about the plan, and their task was to phone the PTA back and leave voicemail to respond to that. This last one was highly realistic. Home care staff, if you know anyone who works in home care, they'll tell you they spend lots of their days, a huge amount on the phone. This one also had a lot of complexities with respect to understanding the standards for PT assistants, understanding the law with respect to the controlled act of a substance by inhalation, et cetera. So on to the feedback. Yeah, as you can imagine, it was a bit of a technical feat to set all this up for the first time. And the students also had to do an element of the evaluation for the course, assessment for the course earlier in the day that was a multiple choice test, also through OnCue, that had some technical issues. So I liked this student email. After explaining the part that's not in the bullet about how there'd been some problems with my setup of the previous part, a simple multiple choice test, she wrote, "Just wanted to let you know, though, that the vignettes portion timing went quite well. I know that it must have been difficult to plan, but I think it was really well done." And I was struck by the fact that other students, lots of students, emailed in advance or on the day with worries for minor technical glitches. I resolved them all easily. Some of them weren't glitches. They just were in their test anxiety. They weren't finding things quickly. And I was monitoring it and answering all along. No other negative feedback, including none after the grades were published with the rubric information. And I had 2 other people helping me mark. One was a co-instructor who was an adjunct faculty member who's a physical therapist with a lot of clinical experience. And I really appreciated that she thought it was a fantastic idea for a final exam. Marking was smooth. Issues with the downloads, which I can respond to in question period if people are interested. And we had the great good fortune to have as our TA, a PhD student who is a PD with extensive clinical experience in a leadership role in a big hospital. And she wrote, when I oriented her to it, "This is an excellent idea. In practice, we talked quite a bit about communication for PTs and how important it was. So I think it's a super important skill that doesn't seem to get the attention it deserves." And after grading, she told me it was a fabulous assessment tool. So tooting my own horn a fair bit, but I am just so relieved that it worked well. And I wanted to share that with you. So thank you for your attention. We'll take questions later.